Hi, my name is Tamara Zanella. I'm a counselling psychologist and I specialise in working with trauma. When we think about trauma in South Africa, we tend to think about recent events of trauma, and one of the first things that generally comes to mind for us in this country is the incidence of violent crime. And that is certainly a huge problem that we face in this country when people are experiencing violent crime and the trauma associated with that. But we also need to think about other experiences of trauma that people might have. So we have a very high rate of domestic violence in this country, and that might be people experiencing the domestic violence, or even for families, children, other people in the environment who are witnessing that domestic violence. That can be experienced as very traumatic. We also need to think about things like road accidents. So we have very dangerous roads, and certainly during sort of festive periods we see very high accident rates. And again, for people involved in those accidents, but also people witnessing those accidents, or even hearing about a loved one who's passed away in one of those accidents, that can be very traumatic for people in this country. Other things like natural disasters, so a lot of the flooding that we've seen recently, those can be experienced as very traumatic. And we also then need to think about early experiences of trauma. So we see a lot of neglect, a lot of early childhood abuse, sexual abuse, physical abuse, emotional abuse, and those things are all very traumatic for people in this environment. So when somebody experiences a traumatic event, they might present as being quite anxious, they might be on edge, they might be quite agitated, they might be quite quick to sort of snap at you or feel quite angry, and those are things that people experience very often. They might also, though, withdraw completely, so people get very cut off. People might resort to using alcohol or substances to try and manage their emotions. And we also see a lot of cognitive deficits when people have experienced the trauma. So very often people will struggle to concentrate. They might not be able to make decisions. Tasks that would ordinarily take them 10 minutes now seem to take sort of an hour or two, and they really struggle to get on with the things in their day-to-day lives that ordinarily wouldn't be very much of a big deal for them. So there are a huge number of symptoms that people can present with when they've experienced a traumatic incident, and even physiological symptoms. So often straight after a recent event, people might have diarrhea, people might be vomiting, we see a lot of neck and back pain, people presenting with headaches and migraines, and that's very, very common following a traumatic incident, because it's your whole system that's been activated during the incident, and we see a lot of these symptoms. So for the vast majority of people, they will be able to resolve a traumatic incident without any need for professional intervention. But for a lot of people, they're not able to do that. And that might tend to rely on sort of their previous history, if they've had early experiences of abuse. So we know that for people who've experienced sustained early abuse, it can be a lot more difficult for them to work through the trauma of that event. It also has to do with other experiences of trauma. So if there's been a previous hijacking or a previous motor vehicle accident, that can make it more difficult for people to resolve a recent event. And also things like the support that people have. So if they have people around them that they can rely on, that they can talk to, people that they can get emotional support from, practical support, that's going to make it easier for somebody to resolve the trauma that they've experienced. But for those people who aren't able to resolve the trauma, we see a lot of very difficult experiences for them. So people might present with anxiety. We might see somebody coming in with panic attacks. We might see people with depression. We might see substance abuse, so that's a very common one. And obviously, we think about the diagnosis of post-traumatic stress disorder, but very often that actually presents with one of the other disorders before it gets diagnosed. So trauma has a huge array of symptoms and potential consequences, and it is really important for people to seek treatment when they've experienced a trauma. In terms of the types of treatment, it's not generally recommended that people are prescribed medication for trauma, because it's not actually resolving the underlying trauma. So the reason that people might be prescribed medication is to manage their symptoms. So if somebody's struggling to sleep or they're feeling very anxious, they might be prescribed a medication for that. If somebody's feeling very down and very depressed, again, they might be on antidepressants for that. But that's not going to resolve the underlying trauma. The World Health Organization suggests that there are only 2 psychotherapies that would be recommended for working with trauma. The first of which is cognitive behavioral therapy, and that's a very specific type of therapy when working with trauma. to resolve the negative thoughts associated with it, and really around exposure therapy and desensitizing the person to the experience of the trauma. The other therapy that the World Health Organization recommends is eye movement desensitization and reprocessing therapy, or EMDR therapy. And that's a specific integrative therapy that was originally developed for Vietnam veterans in the US, but it's being broadened to work with general trauma as well. And it's a shorter term type of approach as well, relying on the idea that we all have an intrinsic ability to resolve the trauma. In the same way as our body wants to heal a physical wound, so too does our mind want to heal a psychological wound. And both of these therapies are very effective when working with trauma, but it's important that if you are going to seek therapy, that you need to make sure that the individual that's providing the therapy is properly trained, because there is a risk of re-traumatizing somebody if it's not done appropriately.